I've called you a lot of things, colleague, and now I call you my secretary. I want to thank you for commend the department for more than 250 million, including 8 million to Michigan's Department of Health and Human Services to expand and restore access to affordable Title 10 family planning. I just want to thank you for that. As previously noted, the COVID-19 pandemic has undoubtedly had an impact on the mental health of our children across this country. I have a unique and passion for protecting foster youth, which they're no different. Earlier this year, I led a bipartisan, bicameral group of my colleagues urging your department to determine what resources states and territories need to ensure that every child can have access to timely mental health services and foster care. And we know that the CFSR provide an opportunity to review state child welfare systems. This includes assisting the states by ensuring children and families achieve positive outcomes. However, in order to fully understand the work, we need an updated data to reflect the number of mental health screenings and the frequency in which they are conducted. So, Secretary, today I'm asking if you would commit to reviewing my letter from me and my colleagues, and that the critical information in forthcoming CFSRs.
Congresswoman, first, thank you for your devotion to this issue. We are going to make a special emphasis within the department on foster care. Because of the resources you all have made available, we can actually try to take states to the next level because we know that they're behind on their assessments.
Yes.
They haven't been providing the right data. We've talked about how valuable data can be. Bad inputs produces bad outputs. And so we're going to try to do as much as we can. If you get to the point of getting this bill back better, I will tell you that we will have an opportunity to do far more. But we're going to do what we can because we know in the foster care system, we're seeing too many of our young people age out and then really be in trouble. And so we would love to work with you further on this, and thank you for that letter.
Thank you so much. Also, the pandemic has worsened Americans' maternal mortality crisis. I'm encouraged that the president's budget is reflective of putting resources into it. Last year, I introduced the Doula for VA Act to create a pilot program with the Department of Veterans Affairs, providing veterans the access to doulas, which they have been denied. So, Secretary, can you explain to me how the president's budget will grow and diversify the doula workforce, as well as other proposed maternal health pilot programs?
And Congressman, thank you for the question. As you've heard in some of the previous responses I've given, we are making maternal health a major focus. There is no reason why a woman in this country today should die as a result of birth of a child. It's even worse, of course, for the child as well, now growing without his or her mother. And so we're going to do everything we can. We're encouraging states to join us. I mentioned the program where we're going to expand access to postpartum care to 1 full year instead of just 60 days. But we need states to buy in. So I would encourage you to go back home and chat with your folks in your state of Michigan.
But I wanted to specifically encourage you to incorporate doulas. We know, especially in low-income areas, sometimes the doulas that are in the community are the only support system that can help nurture a woman through her pregnancy and post-pregnancy. So my ask specifically is for please continue what you're doing. And I want to continue fighting, but I know how important the doula component is to ensuring maternal health.
You all are moving us in that direction through some of the legislation that's been proposed. We understand the importance of some of the paraprofessionals. You don't need to have an OBGYN like my wife in order to provide good care.
Right.
In fact, she's one of the first ones who will tell you that if you get a person who can give guidance to that woman during the 9 months of pregnancy, we're all going to be better off.
And I just want to remind, while I have these 2 seconds, is that foster children are wards of the court. It's on our dime and our responsibility to take care of them. They have been through more trauma than most adults, and our commitment to them through their mental health is extremely important. I thank you, and I yield back.
Thank you. What we've been through as a first round, what I'd like to do is proceed